Hello, my name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. There are 5 or so sections in this month's journal, and what I'd like you to focus on is first, 1 year on from Phoenix, what do we know? I've written a little introductory piece. Then there are 3 validation studies. One from a 9-center study, 2012 to 2018, by Sanchez-Pinto et al. This will be a late breaker study at the conference. An oncology population, 2018 to 2020, from Europe, by Vorsten van Asperen et al. And a third validation study from the UK on emergency transport, 2014 to 2016, by Carter et al. There's an accompanying editorial, great title, Phoenix Rising, External Validation by Lee Polikoff. And then the sort of star of the journal, there are 5 reports or expert panel commentaries from the writers of the Phoenix criteria, covering evolution and definition, influence of interventions, stages in severity, world-relevant application, and parsimony and efficiency. The second group of items that I'd like you to look at, if you're at the conference, are the late breakers, the Sanchez-Pinto validation study that I've already mentioned, durable central venous access by Shostak et al., and machine learning and Pew's implementation by Mayam Purath et al. Then there are some items on skills, mainly to do with airway and resuscitation. There's a clinical investigation on pediatric resuscitation skills, bag tube manual ventilation using mobile SIM and assessing competency. And this is by McCormick et al. And then there's a feature article from the Near for Kids database on tracheal intubation skills and maintenance of those skills across center by whether or not they have a fellowship program. And that's by Kishida et al. And there's an accompanying editorial. The third group of items are other clinical investigations, Sepsis and AT3 and APC by Tran Dang Zhao et al. That's a clinical investigation. A research letter on persistent inflammation, immunosuppression, and catabolism syndrome by Tanimura et al. Citrate, anticoagulation, and CRRT, and filter outcome. A multicenter study from Turkey, 2022 to 2023, by Kittir et al. And the final is a research letter that follows in the film in the theme of family-centered care. So this is parent-reported secondary stressors, inventory score, and bedside presence by Oman et al. And finally, 2 items. Back to Physiology, Part 3 of the Circulatory Support series that Brunicki et al. Have written, and this one is on acute mechanical support. And lastly, I think this is a first, a PCCM trials talking about a Bayesian adaptive study, and this is the ICE-CAP or cooling duration post-cardiac arrest, and this is an adaptive design to look at duration finding trial, and this is by Van Buren et al. So altogether, great read, lots of content. Hope to see you in Orlando. Do come up and talk about the journal. Thank you very much. See you next month.